Today's guest is Elisha Allred, a certified orofacial myofunctional therapist and registered dental hygienist with over 30 years of experience in dentistry. A longtime airway and TMJ-focused clinician, Elisha brings a root cause, whole family approach to oral and airway health. She offers boutique one-on-one care for children, teens, and adults, helping address issues like mouth breathing, snoring, tongue thrust, and orthodontic relapse and TMJ concerns. A homeschooling mother of 3, Elisha's work is deeply grounded in holistic healing, relationship-driven care, and a passion for helping families thrive through better breathing and proper oral function. We are so excited to have her as a guest today on The Lifestyle Herbalist. Hi, welcome to The Lifestyle Herbalist, the podcast where holistic wellness meets everyday living. I'm your host, Dabney-BS. I'm a registered dental hygienist, a clinical herbalist, and a certified health coach.
And I'm your co-host, Sabrina Cooper, a registered dental hygienist with a bachelor's in oral health promotion, a certified culinary nutritionist and herbalist, and a mindfulness and mindful eating coach. Together, we explore the intersection of holistic health, herbal wisdom, and joyful living. From plant-powered remedies to kitchen medicine, mindful moments, and conversations that feed the soul, we're here to help you feel vibrant, grounded, and inspired in your daily life. So steep a cup of something soothing, settle in, and let's grow well together one episode at a time, bringing you a healthy dose of happiness.
Welcome, Elisha. I'm so excited to have you here today on The Lifestyle Herbalist as a myofunctional therapist and a dental hygienist, just like Sabrina and I are. Tell me, how did you get interested in myofunctional therapy?
Well, I have been in dentistry for close to 30 years, and I was with a TMJ slash airway specialist for 20 of those 30 years, and I started seeing a pattern with my patients that came in with sleep apnea and TMJ issues. And so that led me to investigate the root cause over time. I saw more and more people coming in with these same issues. And so that led me into going to a holistic conference. And at that conference, I was learning more and more about the systemic connection with the mouth and the body. And myofunctional therapy came up and it drew my interest. And then I started investigating that. So here I am, 3 years into it, I think it is now.
Wow. Isn't it neat how these little things just take us through these little rabbit holes and then the journey just continues on? Well, for our listeners who are new to myofunctional therapy, how do you explain what it is and why are the muscles of the mouth and the face matter really for the whole body?
Myofunctional therapy is essentially like physical therapy for the mouth. So we're working with the tongue and how it rests, how the lips are sealed, how we breathe, swallow, and how we use these muscles all day long, which impacts our health.
So is that a hard thing to let somebody know what it is that you do when they ask, well, what is it that you do? What does that mean? Is it hard for them to grasp it?
Yeah, at first it is. I know that I usually relate it to posture, how we think about posture and sitting up straight with our shoulders back. And I say that your tongue has a posture too, which is kind of funny, right? But I just explained to them where the tongue posture should be. It should be in the palate with the lips closed and breathing through the nose. And then we kind of talk about breathing a little bit. So all of that, how they coincide each other is a way to at least open the conversation and then go into how development happens with children. And yeah, so we just kind of go from there.
Yeah. What are some of the common signs that you see with patients who might need your help?
Well, I notice now that I know what I'm looking for, I notice that a lot of them are breathing through their mouth. And even if, I always joke with them, it doesn't have to look like Napoleon Dynamite.
Right.
It is a slight opening in their lips. From a dental hygienist perspective, if I notice they have a lot of decay, that's one thing that we'll talk about. If they're telling me they have a good oral hygiene regimen at home, they eat healthy foods, I'm not seeing a lot of plaque and bleeding, and then they're still getting cavities, that makes me say, I wonder if they're mouth breathing. So that kind of opens up the can of worms from that perspective. But so I look for the lips to be slightly open. I look at their tongue posture when they're not talking. if I can see. If their
Mm.
lips are a little bit open, I'll look for the tongue being low. I mean, most people need therapy, honestly. Anybody that needs orthodontics needs myofunctional therapy. I look and we talk about clenching, grinding, jaw tension. Look at their airway when I'm doing an exam. When I'm doing an oral exam, I look at their airway. If their airway is small, then I look at, I start looking at the size of their neck, which opens another conversation of, do you snore? How do you sleep? And that leads to other questions. Do you have chronic head and neck tension? So those are the kind of conversations I have in the dental chair. Now, if someone's seeking me for myofunctional therapy, a lot of time they already have researched what, that they mouth breathe, or, they've been told that they have a small airway, things like that, but they still don't really notice, or they still don't know the root of why. So when I can bring them in for an assessment, we review all of that.
Hmm. Fascinating.
Mhm.
As a hygienist, I saw a patient just this week. Actually, it was yesterday, and she's well put together,
Mhm.
professional woman. When I took her radiographs, she had three new areas of decay, and one of them was rather large.
Mhm.
And she had, other than just a little bit of like buildup on just the normal anterior teeth, she really had very light plaque. And so as I was talking to her about, these risk factors and things that might be causing her cavities, she says, well, I know I breathe from my mouth. And I've
You're
tried
like,
mouth taping.
aha.
I tried mouth taping and it didn't work for me. It kept falling off. And so we were talking then more about, maybe finding a different avenue for sealing her lips together. But you're right. It is a perfect storm to have, that mouth breathing. And she didn't have the normal like inflammation in the front of the teeth, which is,
Mhm.
around the anterior area, which is pretty evident with somebody who is mouth
Right.
breathing.
Right.
But she did have more posterior inflammation there. But
Yeah.
anyway,
Yeah.
have you seen the movie Marty Supreme yet?
I don't think
It's
so.
out in the theaters right now, and
Okay.
it's about a ping pong fellow. He wanted
Oh,
to win.
yeah.
Yeah, okay. Um, I don't know if it's Marty's character or if it's this actor, but I kept thinking the whole time I was watching the movie, he's a mouth breather. Every single scene, his mouth was gaped open. I'm not sure he
Mhm.
put his lips together at all, really. During every single scene, his mouth was gaped open. So I'm thinking,
I bet it's not his character. I bet he naturally breathes that way because when we're not thinking about it, we do what we're supposed. It would be hard
what's
for him
natural?
to exactly. You tend to go back to what your body wants to do. And I have noticed, and I share this with my littles that come in that are into sports. Um, do you want to be a good athlete? And especially the little boys, oh yeah, I want to be the best soccer player and I want to play professional and this
Oh,
and that. I'm like,
sure.
one of the best things you can do is learn to breathe through your nose. And
Hmm.
so I'll tell them, if you look at athletes that are very good at what they do, usually they're breathing through their nose. The ones that run faster, professional athletes train that way. And
Yes.
so we do, I think on my paper, I did the Bolt test, the breathing oxygen level test. So that
Mhm.
kind of gets them into thinking about their breathing. So yeah, I'll be interested to see that movie because that's probably what his natural posture is.
Yes.
And once you see it, you can't
You
unsee it.
can't unsee it.
And my patients can't unsee it either. They'll come back to me and say, "Oh my gosh, my aunt does this. She needs to see you." I mean, you start seeing that and there's a look to it, and which is usually that longer third on the bottom portion of the face because the
Yeah,
face should be three, right? It should be, I mean, nobody's
proportionate.
perfect, but should be proportioned in threes down. And then when you see a longer bottom what am I saying? What am I
Yeah,
trying
more
to say?
flaccid face, kind of longer, elongated
Elongated.
skull.
We call it long face syndrome. When you see
Mhm.
that, that is a chronic mouth breather, and that's how
Yeah,
they developed, unfortunately. And that's the sad part of adults is it's a lot more to deal with. As a child, we can correct this. Yeah.
right. It's amazing to me how many people think they're healthy. They think that they're going around through life and they're healthy, but so many people don't understand the significant impact of mouth breathing versus nasal breathing.
Oh no. Oh no. Yeah, and it is like another thing is snoring.
Yeah,
People think snoring's normal. It's not
right.
normal. I
Right.
tell people that all the time. They'll go, "Oh yeah, I snore a little bit," or they'll laugh about it and say, "My husband or my wife sleeps in the other room." I'm like, "That's not normal unless you're sick. If you're snoring, then you probably need a sleep test, and we need to start investigating why you're snoring."
So how does mouth breathing, tongue posture, or improper swallowing impact things like sleep, stress, digestion,
Yeah.
and chronic inflammation?
Okay. Breathing and oral posture play a huge role in how the nervous system behaves. Mouth breathing, especially at night, is linked to lighter sleep, more frequent arousals, less oxygen. Less oxygen. We need oxygen. Oxygen heals us. Everybody's
Yeah,
got to have oxygen. That's the one thing we cannot live without. We can live without
right,
food and water for a little while, but we cannot live without oxygen.
right.
So that alone can increase your stress hormones and inflammation over time. Your tongue posture matters because when the tongue's not resting in the palate, it can contribute to a smaller, less stable airway, altered swallowing patterns, and even digestive inefficiency because swallowing begins the digestive process. Over time, those patterns can keep the body in a sympathetic or fight or flight mode.
Hmm.
So, when I see kids that are diagnosed with ADHD, or even adults for that matter, that makes me wonder what that the first thing we talk about is how do you sleep? You know, if
Yes.
we're all, and that's for all of us, right? It could be just hormone related, but we want to find the root cause so we can start dealing with it. But anyone that's not sleeping well over time, it takes a toll on your body. And something I really love to share is for children, that's during their when they're sleeping during their restorative time is when they have the growth hormones secreted.
Mm.
So if they're not getting restorative sleep, they can be smaller. They have less attention. They have
Oh,
ADHD symptoms from not getting the oxygen that they need. And they're now seeing more gray matter in the brains of children that mouth breathe. So it's literally causing brain damage without saying it that way. I mean,
yeah.
it's truly what it is. And for you and I, it contributes to dementia, Alzheimer's. Like our
Mm.
brain, while we're sleeping, needs to defrag kind of like a computer.
Yes.
When we're not getting that on a regular basis, it affects our memory, which is an epidemic, really. I mean, what person do you know that doesn't have somebody in their family that has some kind of dementia or Alzheimer's? I know we have it a lot in our family.
Yeah.
But with that being said, the more and more research that comes out, like my husband's dad passed away from it, his dad's mom passed away from it, his dad's brother passed away from it. But even with all of that, I think our epigenetics matter more than our genetics. I really do. So I
Mhm.
think when you know that those things are in your family, this is the time to like start doing things to help change that pattern. I believe
And
we
it
can
can
change
be.
it.
I do too.
I
I
absolutely
think
believe we can.
science has shown that it can be changed. Like people want to say it's in my genetics. Yeah, that's coded that way. But if you don't ever trigger it to turn on, then you're okay. So
Exactly.
let's just work not to trigger it on.
Yeah, exactly. So we've done things holistically to help try to prevent that. And you can do what you can do, right? But breathing is we've got to breathe more. It also sets you up for cancer and just chronic inflammation because oxygen heals. That's why
Hmm.
they have oxygen chambers, right?
Right, right. Well, I had a patient who didn't know he had sleep apnea. He's a bachelor, and he during the night had a heart attack. Called 911. I mean, he was alert enough to know that something was happening, but turned out he had sleep apnea. He stopped breathing, had a heart attack, and yeah, he was in the hospital for quite a while. But now he's on a CPAP machine.
Yeah.
But yeah, it affects our whole body.
Yeah, and it could have been prevented a long time ago because if I could guess, he probably has a narrow palate. He probably has a small airway. Most people that have sleep apnea have the same problem. So myofunctional therapy is like an adjunct to help people that have sleep apnea. Something I do want to share with you while we're talking because I feel like so many, I would say at least 90% of the patients that I see have not have not been explained to why what an AHI is on their sleep test. And so they'll either be told they have it or they don't have it. So an AHI is the number that was created to help put you in a certain category, basically.
Okay.
Um, the A stands for apnea, the H stands for hypopnea, and the I is index. So it's your apnea, hypopnea index. And so you're not considered to have sleep apnea unless you stop breathing more than 10 seconds. So you could stop breathing 5 seconds and it wouldn't be an apnea. So hypopnea is lower oxygen, but it's not apneic. So what they do is they take those two scores and put them together to give you your AHI. So an AHI of 0 to 5 is considered normal, which is still not normal in my eyes
Mhm.
because we're talking about Western medicine here,
Right.
which
Okay.
I'm a rebel of. I'm just kidding. I'm just kidding. No, 5 to 15 is considered mild. 15 to 30 is moderate, and over 30 is severe.
Wow. So what
So
would
I always like to get that
yeah,
test in.
what would you do for someone that is a 0 to 5, especially if they have in their mind like I'm good. I don't
That's
need
right.
this.
That's
I'm
right.
good. Like
That's where we come in and say, but you're not. According to Western medicine, you're okay because they're using those numbers. But women, especially like you and I, that are smaller framed, can tend to have upper airway resistance syndrome. So it's not they'll pass the sleep test, but they're collapsing and they're not getting the air that they need. So they go on and on and on with not getting good sleep. And then here we have hormonal issues, dementia, Alzheimer's, all kinds of stuff, health issues, but
Mhm.
they're told they're fine. So that's where we say we've got to get you sleeping better. And it's not just me, it's me with other people that help them like you doing herbals or supplements, setting up a good sleep routine, things like that, that I help people work with and work in conjunction with other providers.
Wow. Yeah. So, many people focus on teeth alone. How does myofunctional therapy complement dentistry, orthodontics, and airway focused care?
Well, it supports orthodontic stability, reduces relapse after braces, especially if you've had expansion. It improves the outcome for airway focused treatments, and then it addresses habits like tongue thrust and clenching. So the tongue, they say, is about 4 to 6 pounds of pressure on the teeth. So I'm looking at one of my biggest referrals is orthodontics with relapse. A lot of times they have a tongue thrust, and I just kind of explain like we can use metal and all kinds of devices to put the teeth in a certain place to make them look really good. But if we don't deal with the function, which is the muscles of the face and the tongue, then we are going to relapse because muscles always win. It's that
Always.
light pressure that makes the long-term positive outcomes. So we want the tongue. The tongue is the natural scaffold of the palate. So the tongue being in the palate all the way, not the tip of it. People think their tongue's up when they have just the tip up. It's the whole tongue.
Oh,
When it's in
interesting.
the palate all the way, like a light suction is what I would call it, then that puts that pressure all the way around your teeth to help develop the palate properly, but also that gives room for the teeth to come in properly. So people that are in braces and they've never dealt with any kind of tongue posture or their lips sealed and this and all of that, they get the braces off and they relapse. That's why almost and you would agree with me, I'm sure, Dabney, people that have had braces as children, almost 95% of them will tell me they need to do braces again because they were in braces for 3 years and it relapsed, right?
Right.
It's because we never dealt with the function. We
Right.
only fixed the problem that of aligning the teeth. So the swallow,
Hmm.
if you got a tongue thrust and you're swallowing 1 to 2,000 times a day, that's 4 to 6 pounds of pressure, 1 to 2,000 times a day.
Right. It's
And
ortho without the brackets.
yeah, in the wrong kind of ortho for that matter.
Right.
But they'll have an open bite. So I've learned to look for like a lateral thrust. That'll show you an open bite on the right side. So we've got to correct that. Open bites in the back. I always tell kids, you ever see people you say they have buck teeth? I can promise you their lips are open. That orbicularis oris, the lips need to be sealed to hold the teeth back, and also the tongue being in the right spot. So the tongue up with the lips sealed and breathing through the nose is going to prevent those teeth from shifting all over the place.
Yeah. Yeah. It was interesting. I took a yoga class one time and the teacher said, "Okay, we're laying there, toward the end." And she says, "Now we're just going to relax, close your eyes, um, put the tongue to the floor of the mouth." And I thought, "Oh, no, 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 no."
Yeah,
So
no, 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 no.
after class, I told her, I was like, "Well, I just want to make a comment." I was like, "This is kind of what you said, but in my training as a hygienist, like when we're relaxing, like the tongue should go to the palate, like all the way up, and our teeth are slightly apart. She goes, wow, thanks for telling me that. She says, in yoga training, they told us it should be at the floor of the mouth. So,
Hmm.
how many people are being told that it should be at the floor rather than being, I mean, if when you relax, it naturally just, yeah, it just naturally goes to the roof of my mouth. I mean,
That's
for
good,
most
but
people.
most people don't. Most people do not have tongue posture like that. I would say 90+% don't.
Wow.
How many times do you see a nice wide U-shaped palate when you're looking in the mouth? I would say
Oh,
very
right,
seldom
right.
for adults for that matter.
Yeah. I see my little grandkids walking around with their mouth open. I was like, close your lips, close your lips.
Yeah, yeah,
It
I've got
matters
one
so
too.
much. Hmm.
Try not to
Yeah.
say too much.
Right? I know.
Just enough
Yes.
to like,
Yeah.
yeah, absolutely. I think that, just being aware of it is huge. And that's the hardest part I think of my job is helping children to be aware of their bodies.
So, what age groups do you typically see?
I see ages 5 and
Okay.
up to 180. No, I'm just
Oh,
kidding.
nice.
And I typically I get a lot of calls for babies and toddlers, and I refer them to a sweet therapist that I work, not together with, but I trust her. So her and I
Hmm.
kind of encourage each other. Hmm.
Yeah. Okay. So 5 years up, and you do virtual.
I
Uh,
do virtual. I do have to see them in person. I feel like that's very important that I'm actually with them for their first visit so I can take a really good look at all the things and talk to them about their health history and just make sure that it's very comprehensive because in my mind I'm spinning thinking, okay, who else can help with this? Because it's not just me. I'm part of the puzzle. I'm not the whole shebang. I know enough to help them to get to other places. So I'm looking at posture. I'm
mhm.
looking at their food, like processed foods, mushy foods are really not helping our children. So we talk a lot about, the diet, their screen time,
Yeah.
things like that. So I can put together a good treatment plan so they can develop properly.
How does screen time affect what you do, or
Well,
or development or
yeah, I mean, I
posturing?
think it obviously overstimulates the brain. We know that, but it causes forward head posture, which is not good for, your airway. You would move forward anyway to have your airway, but it causes lots of head and neck tension, and then you get bad posture, and then everything kind of starts, falling
Slipping
apart at
away.
that point. But another thing is like to make sure that they don't have a tongue tie.
Okay.
So as a hygienist, I'm not allowed to diagnose a tongue tie, but I'm trained in that. So I know to, at least if I see it, I'll get them to the right provider because the tongue tie will cause a lot of head and neck tension. It'll cause forward head posture. It will prevent the tongue from being able to rest in the palate. So those are the things. Now, does everybody have a tongue tie? No, some people are just really, really weak because they've never used their muscles the right way. So they've been overcompensating with their neck muscles or their masseters and whatnot. So I kind of look, to see do we have restrictions there with their lips or their tongue or even their buccal frenulums,
Oh yeah.
just to see, um, you know, if that's part of the problem. Because it pulls down. Think about it, it pulls down. I don't have a tongue tie, so for me to, me training my tongue to be up was pretty easy. Other than I don't have a lot of space, I do have a little bit of that elongated third at the bottom from mouth breathing when I was younger. And I remember looking back that I had really enlarged tonsils growing up. And I was, if I got tonsillitis one more time, they were going to take my tonsils out, and then I didn't get it. So, and that's frustrating working with ENTs when you've got an airway issue. They don't like to take tonsils out unless they've been sick so many times. So we have to work hard. If we've tried everything, I like to try like herbals, like someone like you to help with just seeing if we can get their immune system under control and get those tonsils down.
Mhm.
Um, and just working with some other different modalities to see. But if not, then they may need to have their tonsils and adenoids removed.
Right.
So I'm looking at that. I grade that during the assessment, and then we can relook at it again in a few months and see where we're at. A lot of times, if they've had chronically inflamed tonsils, I just don't see them go down a whole lot. They can be almost like fibrotic.
Oh, yeah.
And there was a really good study called, I think it's called the CHAT study, that came out where they actually looked at the tonsils under a microscope and saw that they had viruses embedded in them.
Oh, my.
So
Wow.
if you've had Epstein-Barr, things,
Oh,
chronic
sure.
colds when you were growing up, things like that can be embedded in there, even though you're not symptomatic, but they stay
Yeah,
inflamed. And that's in the holistic community, a difficult thing to deal with because I'm absolutely holistic, just like you are. But if you can't get them to go down, then what's more important? If you're keeping tissue because it's lymphatic tissue, but it's not functioning, then
right,
what are we doing?
right.
So that's where we kind of get in this like trying to figure out what's the best way to go about it.
And the best thing might be different for each person. It's really
Exactly.
individualized and bio-individual. Yeah,
Yeah, just kind of walking. I tell them I'm here to hold your hand and walk through this with you
mm,
and give you suggestions, and then ultimately you get to make the decision. I'm just going to educate you on what I think and give you recommendations and try to support you in whatever decision you make.
yeah. So I've had patients who have had tongue ties, children,
Hmm.
um, and how important it is for them to see a myofunctional therapist prior to having that release versus having the release and then going to a myofunctional therapist.
So I can't tell you how important it is. It's so important. The tongue does not know what to do.
Hmm.
It's never been able to when it's tied. You've compensated with your neck and your jaw and even your frontal area. I mean,
Yeah.
you don't even realize how much you use all of that compensating to do the things you need to do. So when you see a therapist prior, then we trained the tongue since the cranial nerves are all connected, right? It's communicating to the brain. We train the tongue where it's supposed to be and how it's supposed to move properly, and we tone it. We tone the mouth and make everything really healthy. Then you have the release, and then we go to stretches and then back to therapy again. Um, People that you see on the internet talking about having a bad release or a bad frenectomy where, oh, you should never do that. I can guarantee you most of them have not had therapy. So
Right,
you're looking at two different ways of doing it.
right.
So, in fact, the provider that I work closely with, he will not do a release without a myofunctional therapist saying that they are ready
Wow.
to give them the go because it makes him look bad when you go back and say, "Oh, this doctor
It
did
didn't
this to
work.
me and it didn't
Hmm.
work. It grew back." And I had a patient I saw on the dental side 2 years ago, and we told her I saw her for a dental cleaning. We told her she had a tongue tie, and then she left that day and went and had a release done. And then I saw her 6 months later, and she came in. She said, I had the tongue tie release. I had the frenectomy, is what she called it, and it didn't help me at all. And I look in her mouth; she totally reattached.
Wow.
She went to an oral surgeon and got
Wow.
it clipped, as they call it,
Yeah.
and no exercises, nothing. And
So
she
the
had
tissue
scar
just
tissue.
healed. It just
Oh
healed
yeah,
back.
it totally reattached, and then she has this thick scar tissue under there. I'm like, no
Oh,
wonder it didn't work. I mean, you
yeah.
didn't do it the right way. And I had briefly told her I didn't want to give her a sales pitch that she needed
Right.
therapy before,
Yeah, yeah.
Yeah, so that's not smart. Don't do that. I tell patients, please go find a therapist.
Right. Go there first, then get your release, and then go to therapy again.
Hmm.
Yeah.
Yes, yes.
Especially if you want it to be successful. Nobody wants to do it twice, right? Nobody wants their
Yes.
tongue
Nobody
released
wants to
twice.
go through that twice. No,
Right.
no. And also just doing there's a way to do it with a laser. And then
Mm.
the way I like it is called a frenuloplasty. So we basically numb under the tongue, clip it back. Then we go inside and break up the fascia and I'm usually with my patients during their procedure. So I have them move their tongue in different ways and try to suction and do different things with it to make sure we really gotten a good release in there. And then we put a couple little stitches in
Okay.
afterwards. So I really like that way. They tend to heal
Mhm.
better. And then I follow them each day after therapy, and I see them usually day 4 or so when the stitches have dissolved and we start stretches.
Wow.
Hmm.
Wow. That's impressive, Alicia.
I love it. I love it. It's been fun. I'm not against a laser release. I see patients with that too, but I really just love the frenuloplasty because I can tell we can really get in there and break up the fascia because the fascia goes all the way to the feet.
Yes, it
It's the
does.
deep line fascia.
Yes.
So people can get a lot of release in their tension just from having a tongue tie release and doing therapy.
Wow. It's impressive.
Yeah, yeah. It's fascinating. You
Yeah.
think it's just a little string under your tongue, and then it's like, oh
Nope,
my
it's
gosh.
connected to everything.
Yes, exactly.
Yes. So, so our listeners who are maybe pondering about, I wonder if I need a tongue release. I wonder if I have an issue going on. I wonder if I have sleep apnea or if I'm, mouth breathing or nose breathing. What is a couple, one, two things that our listeners can think about for themselves um, that you would suggest that would bring their awareness to
Oh
their
yeah.
own tongue posture or whatever you say? What do you think?
Yeah, I usually tell them just the first step is really just being aware of your breath. How are you
Mm,
breathing?
yeah.
When I took my first course several years ago for myofunctional therapy, it was an introductory course. I remember sitting there and I guess I was a little prideful at the time. I was like, oh, well, I don't do that. And then once I started paying attention, I noticed that when I was in the clinical setting with a mask on, I would drop my lip and I would be mouth breathing. And it's stressful enough that you're running a busy schedule, patient after patient. So you're already a little frenzied. But
Hmm.
then you put mouth breathing in that. And that's why you probably, I was thinking to myself, that's probably why I feel so emotionally and physically exhausted at the end of the day, because I'm mouth breathing most of the time through my mask.
Yeah.
Um, so I noticed that and I started correcting that. And then I started feeling better and noticing, wow, the
Mhm.
oxygen really does matter. So, I bet so many hygienists do that and they just don't even realize it. Because for me, it was more like when I would get deep into concentration, when I'm
Yes.
doing a deep scale or,
Hmm.
I'm trying to get tartar out from under the gum and it's taking a little time and I'm focusing hard, I drop my mouth. It was just a habit for me because I breathe really well through my nose.
Hmm.
The other thing would be to be aware of how well you breathe through your nose. Like, how are you breathing for one? Like, are you breathing through your mouth or your nose? And if you're breathing through your nose, how well do you breathe through your nose?
Can you
Um,
expand on what that means?
yeah, like, do you feel like you get a good breath or do you feel like you have to, breathe through your mouth to get a good breath? I hear that a
Mm.
lot from patients. I don't feel like I breathe enough. I'm like, I want to take a deeper breath. And they
Mm.
feel like they get a deeper breath through their mouth, but they're really not getting as much oxygen that way because that's really more like a chest breathing,
Yeah.
you know?
Right.
So I tell like littles, like if any of the moms are listening to this and they have littles, I get a little popsicle stick and have them hold a popsicle stick between their lips while they're playing with Legos or
Oh,
and just see, do they feel
that's
the
a
need to
great
take it
idea.
out all the
Yeah.
time and and put it back in.
Hmm.
Those are little things. And even for us grown adults, I did things like that while I was cleaning the kitchen at night or certain little things I'd put in my mouth to keeping my lips closed to
Yeah.
force myself to nasal breathe because it's kind of like if you don't use it, you lose it.
Hmm.
You need
Well,
to
it's certainly an
read.
awareness. If you drop that popsicle stick, sure sign you're not you're not breathing from your nose at that moment.
Hmm, hmm. But I try to make that fun for kids. You could do that with your grandchildren too.
Yeah, that's a great
And set the
idea.
timer. We're going to do this for 10 minutes, and see who can hold it the longest or whatever. And also that engages lips. So that's working on those lip muscles to hold together.
Yeah.
So you're kind of doing two things at once. Be aware of where your tongue's at. Most people think their tongue's up and it's not.
Hmm.
Tip up is not enough.
Oh, yeah. I
It's
mean, you can open your lips and put your tip up. I mean, yeah, it's got to be the whole tongue.
Mm-hmm. Yep. Yep. It's got to be the whole tongue. And it's not a hard suction. We start with hard suctions, but it naturally, if you're not tongue tied, you should be able to keep your tongue at the roof of your mouth. And you're not going to do it by just thinking about it because your brain's not going to think about your tongue all day. And it's a natural habit that you have if your tongue's down for it to stay that way unless you go through therapy and learn to train it to be up. Because what we're doing is we're really building new pathways to the brain. We're not just doing these exercises. People will look up stuff on the internet. It takes time. It took me it was over a year to train my tongue to be up.
Mm.
And that's through those little small burst of exercises to create that neuroplasticity that we need.
Yeah. I've had adults over the years who have been not really ankylosed, not really tongue-tied deeply, but they're unable to really to get their tongue doesn't get to the very last molar. And so, when you're asking as a hygienist, take your tongue and feel around your teeth. Anything that feels fuzzy, go back and brush. But if they can't feel it, then they don't know that there's like foods like stuck in the vestibules, like up in the cheek area. Their tongue can't even get it out there and swish that out. So there's more.
Yeah.
I mean, yeah, you're speaking well. You seem like you've managed life okay. But there's other benefits to having a tongue release and being able to move your tongue besides speech. And I know there's a lot of other practitioners who are not necessarily on board with tongue releases because, like, well, we can work through the speech, but it's more than just speech.
The
So much
girl,
more than just
yeah,
speech.
the speech pathologist that I work with, like if they have any speech issues, when we finish therapy, I'll refer them to speech because that's out of our scope.
Right,
But the ones that are myofunctional therapists will tell you, just like dental hygienists, they're not taught all of that. So they have this guilt too, like we do as hygienists, like, oh, well, I thought to myself, I've overlooked this for so many years, but we're not taught that in dental school.
right.
They're not taught that either. So they will say too often to me, I've had kids in therapy for 5 years and not made progress. And the whole time it was the tongue tie that I overlooked because tongue ties are complicated. You can see one that's an anterior tongue tie and go, oh, they look like they're tongue tied. But the hard ones are like we call it a mid tongue restriction.
Hmm.
Um, and those are more, that's why you need a functional test done because those are more of like, we're looking at function, measurements, and like all of it put together will tell a therapist or an airway focused dentist, which I'll say find
Yes.
one in your area
Hmm.
that promotes airway because that's super, super, super important to get the evaluation done.
Yeah.
They're overlooked. It took me a long time to learn how to know what I'm looking for. So I
Mhm.
definitely, even in the beginning of my career with my functional therapy, I feel like I still missed a lot because it just took time for me to see what I can't unsee now.
Right. Yeah. But you're there. So that's awesome.
Yeah,
Yeah.
yeah. It's exciting. I really think it's part of the whole picture for health.
Oh, absolutely. I totally agree. So as we're finishing up, is there any last things that you want our audience to know about myofunctional therapy or things that you do? And certainly we want to get your contact information and ways that people can get in contact with you should
Yeah.
they need your
Well,
help.
I would just say that if you have children, look at these things, look at when they're sleeping, see how their head is postured. Do they sleep with their mouth open? How's their behavior? Like, look at all those things. And if you see your child breathing loudly, snoring, head posture like up, if they still wet the bed at a later age than normal, if they're a messy sleeper, like all of those things will give you an indication that you need to see an airway focused dentist or a myofunctional therapist. For adults, you shouldn't be snoring either. How do you feel rested when you wake up? Do you notice that your mouth breathing? Do you have TMJ symptoms? Sometimes TMJ is 80% muscle.
Mm,
So
mhm.
if you
Right,
have TMJ issues, well, we call them in dentistry, Dabney, TMD,
right,
temporomandibular dysfunction or
right,
disorder.
right,
People say I have TMJ, but that's what they
right.
mean, right? If they're having issues like that, it's absolutely important to make sure that there's no tongue tie there or see what the function is because more than not, it's muscle
Yeah,
and not something that an orthotic is going to take care of. Sometimes it's an orthotic and therapy.
yeah. Good advice.
I feel like that's one of the biggest things that people misunderstand about TMD, and I'm still learning too. It's a
Mhm.
lot too. It's one of the most common pains that people have.
And often very discouraging because it doesn't there's a hard modalities to get it to remedy.
Yeah, and they'll do Botox. Well, you're still not dealing with the issue.
Right.
You're
Because,
covering up the pain,
right.
which is good in a sense, but you're not dealing with why are you in pain?
Right.
So my job is to try to get to the root of it and be an adjunct to other therapies if needed for TMD and sleep disordered breathing. So those things are, I just say pay attention to those things. Listen to your wife or your husband or your partner and see, are they sleeping? Do they seem to be sleeping well? If you hear those things, if you hear snoring or loud breathing or gasping, like get a sleep test.
Absolutely.
They're worth getting. I would tell people as a hygienist, like worst case scenario, you have sleep apnea, but it's so treatable. Best case scenario, you get a test and find out you're fine,
Yes.
right? It's worth
Right.
the test. It's worth the
Yes.
test and push for the test. It's your life.
Right. Oh, and wholeheartedly, like I said, my patient had a heart attack. He almost lost his. So, yeah.
Exactly. I think a lot of people that have heart attacks in their sleep, it's undiagnosed or untreated sleep apnea.
Yes, it was for him. It was undiagnosed. Yeah.
It's very scary. And they're not always overweight. People
Right. Well,
think that it's just people that are overweight, and that's not the truth. I've seen amazing athletes with severe sleep apnea.
wow. Yeah.
It's all about the structure.
Right. Well, Alicia, thank you so much for joining us today. You've been
Yes.
just a delight.
Well,
So,
thank you.
yeah. So, we will have Alicia's contact information in the show notes. Thanks for listening. Until next time.
Thank you.